Black Americans are 3 times more likely to die from asthma than white Americans, 5 times more likely to be treated in an emergency room, and Black women still have the highest prevalence of death from asthma than any other group.
Welcome to For the Health of It, our series where we bring together some of the world's top scientists, analysts, and health experts to discuss some of the biggest challenges in healthcare today. I'm Bill Evans. For today's episode, we're excited to be joined by Kenneth Mendez, President and CEO of the Asthma and Allergy Foundation of America, to talk about the foundation's work to better understand and address disparities in asthma and allergy care. We've recently completed an analysis with the foundation, so today we're going to take a look at the findings and the role that data can play in helping to tackle these chronic and widespread conditions. Welcome, Kenny.
Thanks, Bill. Thanks for having me. Nice to meet you.
Based on the research you've done over the past few years, what are you seeing are the biggest hurdles that need to be overcome to improve asthma and allergy care nationwide, and how have those challenges changed over the past, say, 10 years or so?
Well, sure. A couple things. One is access to care, access to medication. Those continue to be the hurdles for asthma care. There's the cost of medication. There are insurance hurdles that you have to jump through to sometimes get those medications. So all that can be a challenge for treating asthma care, even though we've had new therapies come about over the last few years that were never there previously. The other big picture things I'd say are air quality. Climate change is a big issue because you need clean air. Polluted air can be a trigger for asthma, so that's really important to remember. The final piece of that is probably education. Having an asthma action plan, knowing how to take your medications, knowing how to use your inhaler properly are some of the hurdles that we see in treating asthma.
Both allergies and asthma are widespread chronic conditions, with asthma alone impacting more than 25 million people in the U.S. Our recent research found that in both 2019 and 2020, predominantly Black and heavily Black cities saw a higher rate of ER visits per total asthma patients than in predominantly white cities. This echoes the Foundation's work how demonstrating the burden of asthma falls disproportionately on Black, Hispanic, and Indigenous American populations. Can you talk a little bit about these types of data represent, and how do these insights connect to the public health efforts that can close the gaps in care?
I think that's really important data and amplifies the work that we did in terms of releasing our asthma disparities report, which was a 15-year update to look at how things have changed or not with respect to health inequity and asthma in particular. The report still shows, we last did it in 2005, we released it in 2020, and we still see that Black Americans, as you mentioned, are 3 times more likely to die from asthma than white Americans, 5 times more likely to be treated in an emergency room, and Black women still have the highest prevalence of death from asthma than any other group. Those figures have not changed since 2005, so while the treatments have improved and the incidence might have lowered over time, those gaps are still there, those disparities are still there.
So widespread media coverage of the development of the COVID-19 vaccine has fueled a debate publicly about how racial and ethnic minorities are often unrepresented in clinical studies. What can be done as an industry to get more representation in trials, and how does technology fit into this challenge?
I'd say in terms of trying to recruit more people into clinical trials, I know you're working on it. I know the healthcare industry is working on it. You really need to meet people where they are, and then also try and include more diversity in those who are doing the clinical trials.
Well, Kenny, it's been great having you here today and getting your insights and hearing about the work that you're doing out in the communities. For more information about the Asthma and Allergy Foundation, you can visit their website at AAFA.org. And for more information on Komodo, for news updates, and to learn about future episodes, you can follow us on LinkedIn and Twitter. This has been For the Health of It. See you next time.